My name is Professor Richard Gilbertson. I work at the University of Cambridge and I chair the External Advisory Group for the Innovation Call. So the NHS has set really an incredibly ambitious target for early diagnosis in cancer, so that 75% of cancers would be diagnosed at an earlier stage. That's sort of stage 1 and 2, as we call it in technical terms, so very early on in the disease. Now, doing that is going to mean that we have to do things very differently and use brand new technologies. And so in March of 2021, the NHS Cancer Programme launched this multi-million-pound effort to really go out across the world and find innovations that will help us achieve that. 8 innovations have now been selected, and they're going to benefit from a share of about £10 million. One of those, Pinpoint, is a new type of blood test that could help GPs determine who is most likely to have cancer. So over 9 in every 10 cancer referrals made by GPs in England do not have cancer, but they can undergo multiple complex, invasive, and also worrying and stressful diagnostic tests for patients. So kind of reducing that down to the triage number of patients that we really need to focus on will be important, not just for reducing patient anxiety, of course, but also the pressure on doctors and maximising our use of diagnostic capacity within the NHS. Another example is Endoscope I, and that allows high definition endoscopic, that's a sort of telescope images of head and neck cancers that we suspect, and that's going to be sent to specialist cancer consultants for a diagnosis within minutes. So it's all about using the latest technologies to get those diagnoses rapidly. So going back to the long-term plan, which is really what this is focused on, delivering that ambitious plan for patients across the NHS. That's what the Open Call supports, and really it's the first of its kind in the NHS Cancer Programme. And we're really committed to bringing really more cutting-edge technologies into the NHS. So it's really about working with industry, working with those great ideas that are being developed and making them available to patients wherever they live as quickly as possible. So we plan to launch our next Open Call in the spring. We're going to welcome applications for innovation, creativity, sort of future-proofing ideas across medical devices, digital health and equipment, behaviour, all sorts of models of care. We're really trying to go broad and really get the benefit for patients as quickly as possible.